Hi, I'm Taylor McFarland. I'm a board-certified pediatric dentist practicing in the Eastern United States. I'm also a mom. I've got 3 kids, ages 6 and under. Today, we're going to cover one of the topics that I get asked about most often over on TikTok and Instagram, which, by the way, if you're not following me there, do go find me on TikTok and Instagram at The Mama Dentist. I do tend to share a lot more of my shorter form content over there, but I am trying to migrate a lot of it here to YouTube. If there is any one topic that you really want me to cover, let me know in the comments. Today, we're going to talk about teething and how to survive it. So babies are born with all 20 baby teeth in their jaws. They're just waiting in little pouches called tooth buds to be pushed to the surface by their forming roots. That's what moves the teeth up through the gums, is the roots begin to form. The first teeth to arrive tend to be the lower jaw or mandibular, central or middle incisors. They erupt or come in on average at 6 months of age, but this can vary widely. Some babies, they're born with teeth, that's called natal teeth, whereas others, they may not get their first tooth till like 18 months. That's sort of the line in the sand that we draw where we start to grow maybe a little curious about where those teeth might be and we start to investigate other factors. But you've got from birth to 18 months, a wide range from when children can get their first teeth in. Many parents would like to know a general time frame, even though it can vary widely from birth to 18 months when the first tooth comes in. They'd like to have a general idea of timing between teeth coming in and the average age a child is when certain teeth come in. So I've got that for you. I have some graphics I may put up. First, just to explain the graphic a little bit, it's showing you the primary dentition, so baby teeth, that's 20 teeth, 10 on the top, 10 on the bottom. You have a maxilla or a top arch, so a maxillary arch, and then we have a mandible, a bottom arch, so the mandibular arch. The sequence of eruption for both arches is typically the central incisors, and I've got a graphic. It's central incisors first, followed by the lateral incisors, and then you skip the canines. You go actually to first primary molars, and then you go back to canines, and then to the second primary molars. That would make a set of 10 top, 10 bottom, 20 baby teeth in all. But the fact that they skip the canines sometimes really throws first-time parents, but not you. You'll know. Let's talk about the timing. I'll put a little graphic up for the timing too. For the central incisors, those tend to come in on average around 6 months of age. The lateral incisors then are next. Those tend to arrive between 8 and 10 months of age. And then the first molars, so we skip the canines. Those tend to come in, the first molars around 12 to 18 months of age, followed by the canines, which tends to be 16 to 24 months of age, so around age 2. And then the second molars. Those are the last baby teeth to arrive, the largest and sometimes the most uncomfortable, although plenty of kids teeth them without any discomfort. And you're going to notice a lot of chewing, all of the things that you noticed before between ages 2 and 3. Because they're so big, they can take the longest amount of time to come in fully, but by age 3, most children are fully finished with the process of teething, and then they won't get their first permanent teeth to come in, so they won't have teeth either come in back behind the baby teeth, which is the 6-year molars. They don't succeed a baby tooth, they come in on their own, so they are non-succedaneous teeth. Or you have teeth that do succeed the baby teeth, so the baby tooth falls out and gets loose, permanent one comes in. That happens around age 6. They'll get their bottom front permanent central incisors and or their permanent 6-year molars coming in. So you've got a little 3-year window, and thankfully around age 6, they're bigger, kiddos are better able to cope, and you don't have a lot of sensitivity with teething with older children like you do with younger ones. But just remember, even though the central incisors might come up at 6 months of age, they could also come up for your child at 18 months of age. And the timing of eruption between tooth types isn't necessarily the same. So you could have a child get their first tooth at 12 months, and that doesn't mean 2 months later they'll necessarily get the next set of teeth. It can vary widely. They could all come in really quickly. These are just guidelines, just estimations. It is not a checklist to check off, make sure your child gets an A+ for their teeth coming in. What we look at again is symmetry and sequence. So I don't care so much how long it is between. I am looking at, do they come in with contralateral pairs, so the right side and the left side, around the same time within 6 months, and are they coming in the correct order? Please don't stress about when your child's teeth are coming in, what order, all of these things. Your pediatric dentist will look at these with you. You can bring these concerns to your pediatric dentist. That is why the AAPD recommends that first visit occur by your child's first birthday or within 6 months of their first tooth coming in, whichever is earlier. I'm going to link a video that talks a little bit more about that first dental visit here in the cards, and you can follow that if you'd like to learn a bit more. In terms of what dental professionals look for regarding teething, sequence and symmetry are far more important factors than timing. For example, a 12-month-old who got one central incisor tooth at 6 months old, but they have not yet grown that contralateral or the opposite side at 6 months later, so a 12-month-old say at 18 months, they don't yet have that contralateral side, that's asymmetrical. That point at the 6-month mark, when you still don't have that contralateral pair erupted, you don't have that symmetry, and that might be when we begin to grow curious and look into causes for that asymmetry. Typically, teething all 20 baby teeth, or primary teeth, is completed by their 3rd birthday. Believe it or not, many children don't actually experience discomfort with teething. They'll wake up with a new tooth and parents never even realize they were teething it. There is a school of thought that we parents tend to blame a lot on teething that isn't necessarily so. Little personal aside, even a pediatric dentist with her third child can be guilty of just this. My youngest, I was convinced she was teething at 5 months old, off and on, whenever she was fussy until her tooth did finally arrive at 9 months old. So even me, I know all the signs of teething, I know the sequence and eruption timing, and I got fooled at 5 months and 6 months and 7 months and 8 months. I thought she was teething, but she was just fussy. The reason they think that this is, that parents tend to attribute a lot more to teething than is necessarily so, is because teething is so cyclical. It can be off and on, much like growth in general. And babies are growing a lot. Like, think of just how rapidly they are growing in body length and mass and all of these things over a very short period of time, probably growing pains. And some of that might be teething, but some of it isn't. And it's really hard to know the difference. So don't feel silly if you get fooled thinking your child is teething when they're not, or if they get a tooth and you didn't even know. It can vary a lot by tooth and by child. But by and large, teething discomfort is cyclical and brief. If present, it should last about 2 to 3 days only, and in that period directly surrounding when that tooth is breaking through the gum tissue. So remember I told you, even I got fooled by my third child. I was fooled by my second and my first child too, but I mean, you would think by the third I'd have it figured out as a pediatric dentist, but no. Teething is still one of those things that it's just hard to know for sure if your child is teething. Let's go through some of the normal symptoms that you would expect with teething if your child is going to be symptomatic, which they may not necessarily be, but if they are, you might see drooling. This is often associated with teething, but it's really more a coincidence. It's not really causal. Salivary glands are just coming online at the same time. Sore, puffy, and red gums. Seems kind of obvious, but localized to the area where the tooth is erupting, that can happen. And I'll go over later a little complication of that. It's called an eruption hematoma, and I'll show a little picture in a little bit. We'll get to kind of complications of teething. It's not really a complication, but that's something I'll address in a minute. But typically the gums will look kind of taut and white, pink, sometimes red and irritated as that tooth is about to break through. Fussiness, especially in the 2 to 3 days that surround that tooth breaking through the gums, that is not uncommon at all. And a low-grade fever. And what low-grade means is like 100.4 or less degrees Fahrenheit or 38 degrees Celsius. So that or less, that might be attributable to teething, but anything higher, it may be an illness. There are parents all over my comments who swear their child had a high fever, and that might rarely be the case. Maybe your child happens to run a high fever with teething, but typically, by and large, most kids, it is 100.4 or less. It is a low-grade fever. If you're super nerdy like me and you want to know why they have a fever, it is because in that little pouch surrounding the crown of the tooth, as it is moving through the bony tissue, there are inflammatory cytokines in that pouch. The contents of that pouch are what's absorbing that bone away for it to come up, and inflammatory cytokines are in there. Those inflammatory cytokines elicit an immune response, but a low one, so you can get a low-grade fever, soreness, fussiness, all those things which are sometimes associated with an immune response. And it's from those inflammatory cytokines in that tooth bud. Nerd alert! Tugging or batting at the ear, that is another sign of teething. Another nerd alert. This is because you have lots of innervation in this area around your jaw, your face, and then it kind of coincides or connects to your ears. So many times in adults, when we have sinus infections in the spring, people will report toothaches because their sinuses are swollen and inflamed. Same idea, because their gums and teeth, jaws are swollen and inflamed from teething. You have that accessory nerve supply that runs up to the ears, so they have teething pain, but it is still because ear infections are so common with kids, it may be worth checking out with your pediatrician, having them take a quick look in their ears just to make sure it's not an ear infection. But typically with teething, you will sometimes see them pull or tug at their ears, and that is just due to the inflammation and then accessory innervation that runs from the jaw to the ears. They're connected. Now, sleeping disturbances do occur. This is because they're uncomfortable, and most of our growth happens overnight. So growing pains tend to be overnight. Teething pain tends to be overnight. That's just when our body is growing. Well, their bodies. That is when their little bodies are doing the most growing, is overnight during sleep time, which is great. You know, when you're trying to sleep and they're trying to sleep and their body wants to grow and it hurts, and then they wake up and no one sleeps. But these sleep disturbances typically are short-lived. If you have some type of sleep training that you're doing or a pattern that you follow, try not to get off of that pattern. They're going to be thrown off, and it's going to be that pattern, that consistency that helps them not remain off course. So if something about their sleep cycle changes, try as much as possible or as quickly as possible to follow that typical routine just to help them stay on track. A short sleep disruption of 2 to 3 days can turn into a long-term disruption and a whole new pattern if you let it. So maybe seek out the help of a sleep specialist, sleep training specialist, if you need some help with teething disturbances, if your child is particularly sensitive and does seem to wake up a lot with teething. But I tell you, it's true.
some parents do have a child just cut a tooth and they never were the wiser.
So some kids you may never know. And I don't want you to go in with the expectation that all of these horrible things will happen. That's sort of what social media wants to portray, when there are many, many kids out there who teeth and we never know.
And if you think about it, a little aside, when we are teething adult teeth, so when our kids get adult teeth or 6-year molars, we often don't know.
And so what has changed? It should still be uncomfortable, and maybe they're just better able to cope with it. But I don't know about you, the 9, 10, 11-year-olds that I see,
They're a little more whiny than some of the
1-year-olds and 2-year-olds that I see. Something to think about with teething is maybe there's a lot of growth going on and they are uncomfortable, but it may not be as bad as we think. So try in your mind as much as you can to not have a preconceived notion of what teething will be like, especially a negative one, okay? These are just guidelines so that you know if this should show up, especially a conglomeration or a group of these symptoms, you're like,
it's probably teething.
but they still might be tricky. Yeah, it might not be. Could be an illness, could be just a regular old growth spurt, not necessarily related to their teeth, but it could be teething. But you may have teething with none of these symptoms. They may be totally fine. Wake up with new teeth you never knew. So don't go in with an expectation. This is just information. And lastly, one last little point that would be a normal teething symptom, obviously because their mouth is sore, altered appetite. They may just be a little uncomfortable. They may not want to eat those little crunchy teething crackers that they normally do. They may want more cold or cool foods. That's a great hack, is to put something cold for them to either chew on, put it in a little mesh teether bag. I'll go through these later, maybe in a separate video of just like how to treat or manage teething. They may want to nurse more or less. It just depends on the child, but it may be altered for, again, 2 to 3 days is typical. Now, I mentioned earlier something that sometimes concerns parents is an eruption cyst or an eruption hematoma. And it's because it looks so scary. I'm going to try to find like a non-copyrighted picture that I can show you. It can look like a tumor, a giant wound or bruise. It looks really freaky because it's this big purple blob, but it's always in the area where a tooth is coming in. And what happens is that little bubble, that teething bud, it gets bitten on right as it's coming to that surface, that little bubble. They bite it, it fills with blood, and it's just a big bruised cyst, and it will burst often on its own and not require much of any intervention.
In rare cases, sometimes we do have to surgically open those up. An oral surgeon or a pediatric dentist can do that just to help that tooth come in if they're experiencing any difficulty with eating.
But most of the time, these cysts just resolve on their own. They just look kind of freaky, especially when they're right here in the front. Parents sometimes don't like that, but it's something we just monitor, and it will burst with time on its own as that tooth comes in. Now let's go over real quick the atypical symptoms of teething. So things that sometimes people attribute to teething, but they are not, and you should seek an evaluation by your pediatrician to rule out other causes. Those would be,
as an aside, I had a parent once that was convinced her child was teething, only to realize that her son had broken his arm falling off the couch days prior. So don't attribute everything to teething, especially if it's longer than 2 to 3 days duration. It could be something else. It is worth investigating. And if you go for the checkup, they're like, no, it's just teething. I know it was a pain to drag all the kids and whatever and go to the pediatrician, but at least they didn't have an ear infection that became abscessed or a broken arm.
So some atypical symptoms that you should see your pediatrician if they occur are a fever over 100.4 degrees Fahrenheit or 38 degrees Celsius, congestion and cough, a rash, vomiting, and diarrhea.
And vomiting and diarrhea are a big deal because, one, they're more associated with infection than with teething. Sometimes if they're swallowing a lot of saliva, people think, well, maybe that's why they're like throwing up or they have diarrhea. But these can very quickly dehydrate a child, and dehydration, especially in a baby, is very, very risky. And you want to see your pediatrician just to make sure that they are covered, they are okay, they are hydrated.
So that is another thing. Hydration is key with teething, especially if your child is not nursing or eating like normal. You want to be sure they're staying hydrated. Again, in another video, go into a little bit more of management of teething symptoms. Sleep disruption beyond 2 to 3 days may also mean that you want to involve either a pediatrician or some type of sleep training specialist to be sure you stay in a pattern and you don't establish a new pattern since they've gotten a little bit off with that teething sleep disruption. If it is in fact teething, maybe something else like a growth spurt or an illness. So again, important to go and rule out with your pediatrician just to make sure there's nothing else going on.
So though teething is cyclical, the hard and fast rule is 2 to 3 days at a time is the length of time max that something should be bothering your child that you would attribute to teething. Beyond that, you want to go to the pediatrician and get it checked out.
So now let's move on to what a pediatric dentist and mom recommends for teething. I've kind of alluded to it, so let's get to it. What do you do if your baby is struggling with some of the common symptoms like sore gums and fussiness? What can you do at home to help your child manage that discomfort? I'll let you know in this next video.